Good morning. I welcome you all to the Healthy Conversations. Today, the topic would be varicose veins more than a cosmetic issue. So we all know that varicose veins are a big problem. It's very common, but most of the time they get neglected. And I personally have been trained to treat these varicose veins and any problems that come along with that. So during my career, I have done training in internal medicine, cardiovascular medicine, vascular medicine, and also phlebology. I will start with a question. So what do you think are the three main common medical problems? And what is common between them? So first of all, the most common problem is back pain. The second common problem is hemorrhoids. And the third one is varicose vein. So interestingly, the most common thing about all these three problems is that the medical school curriculum, even the residency and fellowship curriculums, do not spend more than an hour of teaching or training in these three fields throughout the long career. So hence, they always get neglected. So that brings us to the topic, varicose veins. Are they more than skin deep, or are they just like any skin spot on the leg? So what exactly are varicose veins? So if you look at it, in the diagram on the left, on the top, what we see is small, tiny veins. We call them spider veins. They're very common. 1 in 3 women and 1 in 5 men, they have it. Most of the time, they have something going on underlying. And the reason to know that why there could be something going on with them is that they are all connected to a dense network. So all you see is the tip of the iceberg. Below that, there's a bigger vein, which is around 1 to 2 millimeters in size, and we call it reticular veins. And then that is connected to probably one of the saphenous veins, which are 3 to 4 millimeters in size. Those saphenous veins, they are connected through another connection to the deep system, which is taking care of most of the blood in the body. So in general, in the legs, there are 2 types of systems, superficial and deep. Both of the venous systems are carrying the blood from the feet up towards the heart. Normally, the veins carry around 65% of the blood. So of the 5 to 6 liters that is circulating, most of it stays in the vein. It is supposed to circulate, arteries bring oxygenated blood, and the veins take the blood back. So in order for that to happen, we are all designed to have one-way check valves. One-way check valves so that the blood can flow against these tiny veins against the gravity. So one of the biggest myth is that these varicose veins may be completely innocuous and harmless. But if you actually look at it, the flow going inside these varicose veins is so haphazard and that they are a big risk for having a blood clot. The blood pools in the leg if it stays at one spot for a little longer than usual. This is another diagram to show the same thing. The long veins, the veins and the arteries on the left side of the picture, and then you see there is a calf muscle pump. In general, the arteries are a big advantage because they are going to supply the blood towards the lower leg, but there is gravity to their advantage, and also the heart is acting as a pump. However, the veins have a huge disadvantage. They are low flow, and they have to go against the gravity. The only little help they have is from the pump, the calf muscle. Usually the ejection fraction of the pump of the calf is around 70%. That means it can eject most of the fluid that is collected in the lower legs back towards the right side of the heart. We don't want the fluid to get collected in the lower leg because anywhere the blood stays, it will make a clot. And that's one of the biggest risks of these varicose veins. So just a little movement of the feet up and down opens the valves, and it pushes the blood through the muscular function back into the deep system from the superficial to deep, and hence from the deep to the heart. If these valves, by any reason, by any cause, they become bigger in size than usual, the valves don't close properly. As you can see on the diagram on the right side, if the vein becomes bigger in size, the valves don't close. So essentially, the person is left to the mercy of gravity. The blood pools in the lower leg, and it does not progress further. So to say that varicose veins are more than a cosmetic issue it is mainly because there's a lot of symptoms and signs it causes, and there's a lot of quality issue, mobility issue, as well as quality of life issue that it causes. Just to talk about simple things like activity of daily living. If the blood is pooling in the lower legs, that means it's not circulating. So a lot of blood is not circulating. The blood that is pooled in the legs distends the vein. When it stretches the vein, it makes the valve more functionless. The cycle continues. And also when the stretching of the veins happen, the veins feel like heavy, legs feel like heavy and achy and tired. And it's a common thing that many housewives are, at the end of the day, when they're doing cooking or dishes, they just cannot stand enough to complete just the making of the dinner. So that's a serious implications on the quality of life. Or if you ever feel that you're not able to sit too much, for example, you're traveling and your legs feel achy and heavy, that is because the veins are being stretched because of the pooled blood. That means it's basically compromising your quality of life. For example, a lot of people will say that traveling is not fun anymore, and it's mainly the main reason for this is that the legs feel so restless, crampy, and heavy and achy. For people who are active and they're playing sports and all, for example, a 70-year-old man goes to Prescott Lakes Golf Club, and if he has played this game for a lot of years and he's not able to go beyond the 5th hole, that means it's causing a serious complication to his quality of life. So these are the reasons why we get into helping with these varicose veins, because they are no more just varicose veins. There is something going into the circulation which is affecting their quality of life. So the big question is, how common is these varicose veins? Globally, around 25% of the population is affected by these varicose veins. In United States, around 30 million people are affected, and by some estimate, even more than that, if it's just spider veins, 1 in 3 women, as I said, and 1 in 5 men are affected. It's a very common disease in the elderly age group. So 60% of the women in beyond 60 years of age would have some sort of disease related to the veins. So not only that, the vein having a vein directly is a problem. The consequences of the vein diseases, for example, leg ulcers that it causes, it's a big problem. Around 2% of the US population and around 15% of the elderly population have vein ulcers, leg ulcers. Any type of ulcer in the leg, 70 to 90% of them are related to the vein issues, directly or indirectly. So the most common cause of leg ulcer in any leg, even in diabetic, is a venous disease. So it also has huge implications as far as economy is concerned. So by some estimate, $3 billion are spent just on superficial vein disease annually from the healthcare. And as far as vein ulcer treatment is concerned, around $50 billion annually was an estimate when it was done in 2005, and it has been way worse after that. So of all the people, 30 million people who have vein disease, how many of them actually get diagnosed? Not even 20%. So most 80% are in general neglected. And that is one of the reasons of this presentation, is to educate everybody about how common is this and how common are the problems for which we end up getting medications like diuretics, Lasix, or painkillers, which can be harmful to the kidneys and overall health. Of all the people who get diagnosed with vein problems, only 1% get treated. One of the biggest reasons why this happens comes from the history. Till the 70s, 60s and 70s, the only form of treatment available to treat vein diseases was a surgical treatment. And surgical treatment was in the hospital, in the operation room, with an anesthetist doing general anesthesia, multiple cuts in the leg. So it used to be horrendous surgery, a lot of recovery. It used to take 3 months to recover from that procedure, and sometimes even a blood clot used to form after the procedure. So everybody was reluctant to even talk about the varicose vein for a long time, till last 2 decades, when it started that we started having newer forms of endovenous treatment, which means we can simply go inside a vein, from a small pinhole like a needle and treat the whole vein as an outpatient procedures, just like any dentist chair procedures, and you don't need any sedation, and you can go back to work the same day. So just talking about how the vein disease affects the leg. What is the whole spectrum of vein disease? A leg can be completely normal, which is seen in around 60% of the people, with nothing, no swelling, no skin changes. Or it can have mild pigmentation, which we call stasis dermatitis. And this pigmentation is mainly because of the pooled blood has iron. Iron stains the skin. Also, there is increase in melanin in that area. There could be, the skin may become hardened or indurated and thickened like a leather, and it can progressively, because of the inflammation, because of the blood down there, it can progress to have a wound. So the whole spectrum is huge, and if somebody asks you, of all the people that we see in this diagram, how many would have vein disease? To tell you the truth, by statistics, almost 4 to 5 of these 7 legs have some form of vein disease. And that is exactly because the most common type of presentation of a vein disease, a clean, normal-looking leg. So it's not the leg with the ulcers, or it's not the muddy leg. So at the vein center, which is located in Prescott Valley, inside and along with the wound care center, what we do is take care of these vein diseases and help improve the quality of life of the community. So what do we do when somebody approaches us with the vein problems? So first of all, the patient will go through an extensive questionnaire. History is very important. Many times, common problems like vein, leg pain, or leg edema may not be related to circulation. It might be related to something else. So it's very important that somebody who deals with these problems has extensive training in internal medicine. And since it's basically mostly related to hemodynamics, is to pressures in the vein, some sort of training in hemodynamics also helps. So we do a complete physical examination after a history taking. After that, what we do is we do an ultrasound study. An ultrasound study is the examination, which is a non-invasive study, is basically done to diagnose whether the veins are dilated or not dilated, and where are they dilated, are the one-way check valves working or not, is there any clot in the deep vein system, or is there any clot in the superficial vein system. So it takes a lot of time, almost 45 minutes to an hour to do one study, because there is a lot of areas from where the scanning is done. After we do the ultrasound at the vein center, very educated RNs who are specifically trained in teaching about vein diseases and leg edema, they will go through the whole teaching about why these circulatory problems are happening, what is the best way to treat them, how we can treat them without surgery, when is a situation where we need to intervene. So all that takes place at the vein center. We talk about lifestyle changes, simple lifestyle changes like maintaining body weight, walking more, elevations, that might simply change the whole feeling and improve the quality of life. And we definitely want the people to get rid of their painkillers. We definitely want them to get rid of water pills, because they are causing a harm to the leg and they're not doing anything good. Of course, after the lifestyle modifications are implemented, we see the patients back in 3 months. And at 3-month visit, specifically, we are trying to do the questionnaire and physical examination again. And we're trying to figure out whether these vein diseases have been improved by doing the lifestyle changes or not. If not, then we talk about some of the minimally invasive outpatient cutting-edge technologies. And at the vein center at YRMC, we do every single type of vein treatment that is currently available in the world. Some of the treatments, we were the pioneers in the state when it started 2 years ago. We also run a special edema clinic in which people with leg edema from different reasons of leg swelling, mostly lymphedema, lipedema, and other causes of edema, they come for diagnosis and management. This is done in conjunction with an advanced occupational therapist, Donna Hanna, who is specifically trained in edema clinic. We are also located inside the wound care center. A majority of our patients have wounds in the leg. So evaluating them and treating them becomes more like a limb salvage program. It is done in conjunction with the wound care program. And sometimes most of the times, we do adjunctive treatments. So we do the treatments together. So advanced wound treatments in the form of stem cell, amniotic cell membranes, and the cutting edge procedures, along with the ongoing conservative management, that helps the wound heal faster. We also do some research at the Vein Center, which is there to potentiate to propel the science forward, to make sure that if there is anything we can contribute to humanity. Now, coming to simple question, what are the signs and symptoms of vein diseases? Most people present with the legs. There's some spider veins or varicose veins in the leg. So veins which are tortuous and dilated, and they don't look good. So that's a common presentation. However, most people that we end up seeing have some form of additional problems. So leg pain, leg edema, or any skin changes, they are a common problem. So sometimes the only problem many people will have is itchy legs. And for itchy legs, they get every type of steroids, antihistamines. It may disturb their sleep, but usually there is a simple non-surgical fix for those problems, and all it needs is a proper diagnosis. Coming to the next, some of the signs could be, as I said, leg heaviness or achiness. This is most pronounced when somebody is in one posture for a long time. So it could be sitting, for example, when somebody is traveling or watching TV or watching a movie, or it could be standing for a long time. For example, if cooking dishes, or say, for example, somebody goes to Costco, the line is a little longer and they cannot stand enough, that means they have some underlying vein problems. Some of the patients will present with unusual and lesser known complications, but they are basically compromising their quality of life in a big way. So some of these being leg cramps and restless legs. So these are very broad diagnoses which can affect somebody's quality of life in a big way. Vein disease is one of the biggest reasons for leg cramps and restless legs. There are multiple other reasons also, but however, it may be discarded many times, like, okay, dehydration, less potassium, less magnesium might be causing it, but in reality what is going on is there is pooling of blood due to defective valves in the veins, the stretching of the veins, which excites the nerves around the veins and puts the muscle into spasm. The simple fix is conservative treatment, leg elevation, and compression stockings. So there are a lot of people who may have restless legs because of other reasons, but mostly the commonest reason is still the vein diseases. So what are the risk factors for developing a vein disease? Almost anybody can develop vein disease. It's very common. If after the age of 60 years, 60% are affected, so a lot of people are going to get affected. So the number one reason is aging. So as we all age, the vein walls dilate, they become flabby, the muscles become weak, and just like the skin, which becomes flabby. So when the vein walls dilate, the valves don't work, and with continued use against the gravity, they get more and more damage. And so that's a common reason. Vein diseases runs in the families. This is one of the problems which is more inherited than diabetes. If two parents are affected, there's more than 90% chance that you're going to get it. If one parent is affected, almost 60% chance. If no parent is affected, still there are 20% chance that you will get it. So, and many times we do not know the family history because most of our grandparents did not care about the legs. They had a lot of other physical activities going on. The third and the very common reason is obesity. More than normal weight is a common problem now. Almost 65% of the Americans have a higher weight than normal. So it's very common to increase the venous hypertension with the obesity, and that leads to vein problems. Multiple pregnancies. Every pregnancy, because of the release of the hormones, progesterone and relaxin, relaxes the veins. There is a higher volume of blood circulating during pregnancy. And the third and the very common important reason is the gravid uterus compresses the inferior vena cava, which is the biggest vein in the body. So it causes pressure in the lower legs. Due to multiple reasons, pregnancy is the time when many people will see their varicose veins for the first time. And with every pregnancy, it gets worse. And the best thing to do is, during the first pregnancy, as soon as pregnancy is declared, start compression therapy. The other type of problem, which is also very common, and it may be due to superficial vein disease, but it may also cause superficial vein disease, is a blood clot in the deep system. It's a life-threatening problem. Almost 300,000 people die every year because of this treatable and preventable condition in the leg, DVT. Whenever there is DVT happens, it blocks the blood to flow from the lower leg to the right side of the heart. So the pressures due to the connections to the superficial veins get transferred to the superficial veins, and due to the pressure that transfers to the superficial veins, they get dilated, and they're not designed to hold that much of fluid, so they become varicose. And then when the veins are varicose, they stop the flow to the deep system, increasing the clot formation in future. If somebody has superficial vein disease, varicose veins, and if they are traveling, they have defective valves in the leg that causes pooling of the blood for being in one position and lack of activity. So blood is pooling in the lower legs. That is itself is a reason to cause blood clot formation, which usually starts behind the valves in the vein in the deep system. So many a time I see people who after a long flight ended up being in the hospital because of the blood clot in the lungs, went directly from the legs to the lungs. So it is entirely preventable condition. All we need is education. So if you look at this slide, and if we see what is the most common thing in all of these people. So teacher, healthcare workers, the bartenders, the bank tellers, all of them, they have to be on their feet all day. So is it wrong to be on their feet all day? No. But the more we are on feet all day, we are subjecting ourselves to the gravity. So we are causing a stress to the veins, and that's how we end up getting more vein disease. In addition, being in one posture, sitting posture for a long time, for example, truck drivers, most of them end up getting vein disease. Also, the current generation being on video gaming and computers all the time is also not helping. So if there is one activity that we should do every day, that should be stop sitting in one posture for a long time, and after every half an hour, 45 minutes, get up and walk, and that changes a lot of stuff inside the leg. And this is extremely important these days with the COVID. We are staying more at home, that we should start some sort of a walking program on a daily basis at home. So coming to the next problem, which is very common with the leg, with the vein diseases, is edema. Now, evaluating edema is a very, very tricky thing, because a lot of diseases can cause leg edema. Anything that affects the heart failure can cause leg edema. Any calcium deposit outside the heart, pericarditis, which is chronic, can cause leg edema. Liver diseases can cause leg edema. There could be kidney problems that can cause swelling in the legs. There could be less proteins in the body that can cause swelling in the legs. So there are multiple reasons. However, the number one reason to have leg edema is vein disease, chronic venous insufficiency as we call it. It's very common to have leg edema due to chronic venous insufficiency. Sometimes we see patients who have combined problems. They have vein problem as well as kidney problems. They have vein problems as well as heart problems. So it is not normal not to see that vein diseases as a comorbidity to the rest of the things that are going on in the body. When we evaluate patient about swelling in the legs, we are looking at one leg or two leg, which leg is affected? Is it affecting rest of the body, or it's just the ankles or the lower legs? How about the face? How about the abdomen? And how about, did it came up quickly, suddenly, like in the last 1 week, or has it gradually progressed like this? Or is the vein edema is only when somebody is subjected to prolonged sitting, for example, travels, or prolonged standing? We also look for if there is any suggested problems, like if there are varicose veins in the leg, if there are skin changes suggesting that there could be underlying vein problem, or if there is any leg ulcers. So putting together, we come up with the diagnosis. Now, whenever we see somebody, as I said, the first treatment is always education and conservative treatment. What do we do with conservative treatment? We teach about the circulation, but most importantly, we teach about how to prevent and how to importantly keep ourselves away from getting a blood clot formation. So one of the commonest things that we do is talk about obesity and weight management. We talk about elevating the legs. So whenever we elevate our legs, for example, if you're sitting on a recliner, we can, instead of keeping the legs down, we can keep the legs up. For example, if we are sleeping, keeping one or two pillows on the on the ankle side might help. When we elevate our legs, what happens is the blood flows by gravity back towards your heart. So we don't want the blood to pool in the lower legs. We also talk about leg exercises, feet exercises. And like I showed in the second slide, the calf pump is the most important pump for the veins to evacuate the blood from the leg to the heart. So we call it the sump pump of the leg. What we want is somebody sitting to keep moving the feet up and down and on sideways or circles. Basically, the whole idea is to engage the calf muscle to take the fluid back to the heart. We also talk about compression therapy, and compression therapy comes in different types. One of the commonest and easiest one to accept is the compression stocks. At the vein center, we do free compression stocking sizing all the time. Even the vein education is done for that purpose. And we provide a prescription for the right size of the vein. The compression socks are basically designed to act in a very specific way. These are not the TED socks that we receive in the surgery, post-surgery, like the white socks we call them. They are called graduated compression stocks for a purpose, because the most compression is coming from in the ankle, the lesser in the calf area, and more above that. So it's a graduated compression which helps the flow from the foot up towards the heart. In addition, we are also careful. We understand that there is another circulation in the leg known as arterial circulation. So we also directly or indirectly evaluate undiagnosed arterial problems to make sure when we do the compression, we start the compression, it does not compromise the arterial flow. So if the compression socks comes in different types, it could be just below the knee, it could be thigh high, it could be a pantyhose, or it could be just the anklets. So there could be different material that they are made of. Most of the compression socks, they're designed to provide a graduated compression. Compression level can be anywhere between 10 to 50 millimeter mercury. And it depends on the condition of the person, and based on that, we prescribe the level of compression. If somebody cannot wear the compression, which is a common scenario, we see this in 60 to 70% of our patients, that they're not, by some reason, because of either arthritis or back pains or knee pain or hip pain, they're not able to wear the compression stockings. So we educate them mainly about how to wear them. So one of the best things that can be done is using compression aids to wear the compression stockings. So some of them are known as downing devices, and we have those at the vein center to teach the patients. We also talk about non-elastic compressions, and these are mostly in the form of compression wraps known as Velcro wraps. So Velcro wraps, they provide better compression than the compression stockings, and they can be even used when you're sleeping in the night. If somebody is especially in the summers, I hear this common complaint: oh, I cannot wear the compression stockings. I cannot wear the because it's summer and I go on walking or hiking or swimming or running, so they don't look good. So there are compression sleeves available for that purpose, and they are nice sports sleeves that can be used for that purpose. Somebody who is not able to tolerate or they need higher compressions, we do multi-layer compression wraps using different material bandages, and if that also doesn't work, lymphedema pump or pneumatic compression pump is used for that purpose. Now, once we decide after 3 months or 6 months that the conservative therapy is not working, we talk about different other forms of treatment, which mostly are very non-invasive. So it can range from anything from giving a simple injection inside the vein known as sclerotherapy to putting a catheter inside the vein known as RF ablation or laser ablation, or putting a chemical known as a glue, medical glue, cyanoacrylate inside the vein, which is known as Vena Seal. And sometimes we do outpatient mini phlebectomies, which are minor surgeries and which are very good cosmetic results. Now, coming to these minimally non-invasive therapies, one of the commonest that has been used till last 5 years, mostly 97% of the patients, is thermal ablations. In this, we put a thin catheter, and the tip of the catheter is a copper element. We put it inside the vein under ultrasound guidance after numbing the leg, and then we increase the temperature of the tip of the catheter to 250 degrees. With the heat, we close the vein. This is known as RF ablation. This is an outpatient procedure, and however, in the last 3-4 years, we have switched to even much lesser minimally invasive procedures, and one of them, this is a picture of the catheter inside the vein with the heat being treated, and one of them is known as Vena Seal, in which a chemical or a medical glue is injected inside the vein. The glue basically does not do the glue function, but it's a chemical, so it reacts with the wall of the vein, and it contracts the vein, and it closes the vein just like heat does. But it is a completely painless procedure, and we do this in almost 50 to 60% of our patients now. Another common procedure, which is also an aggressive form of sclerotherapy known as Varitena. This is a medication which is in a foam form, so it's easy to work on very tortuous veins. One of the commonest problems with the varicose veins is that they're very tortuous. Sometimes the catheters have difficulty negotiating those tortuous veins. So one of the other procedures we do is known as sclerotherapy with a foam. The foam is easily able to travel inside the veins. It reacts with the vein wall, and it closes the vein, causing it to close. So this is another picture to show the surgical procedure, mini phlebectomy, or we pull the vein out using very small incisions, and the recovery time is good. It takes a few weeks to recover from it. This is, sometimes we end up doing a combined procedure. So we, on the larger straight vein, we will do the RF ablation, which is thermal ablation, and then we do phlebectomy on the rest of the veins. So combined procedure becomes essential in many people. So, any questions?
Yes, Dr. Kumar. Rita would like to know if varicose veins are small and not painful, should I worry about having them treated?
That's a very good question. So small, painless varicose veins probably in most instances do not need to be treated. What we usually do in such cases is we try to go through the whole history. We look at how is it affecting, does it cause any leg swelling, or other than pain, sometimes it might be causing skin changes or leg ulcers. If it is not causing any of those problems, then most of the times we end up prescribing conservative therapy. And ultrasound to a minimum is required to make sure there is nothing else going on in the body. Like I said in the first slide, these veins are all connected. All we see is the tip of the iceberg. We don't know what's going on with the valve function. Is there a blood clot sitting and we don't know? So a complete ultrasound evaluation is needed, but we don't need to treat all the veins. And if it is required for a cosmetic purpose, it's a different thing. But what we need to do is follow a conservative treatment routine, just leg elevations, feet exercises, walking, maintaining an ideal weight, and using compression therapy on a daily basis.
Great, thank you. Bridget has a question. She would like to know, does crossing your legs cause varicose veins?
Okay, crossing the legs causing varicose veins is a common problem. Let me uncross my legs. So Yes, so it's a very, very common question, and there is no evidence, there is no literature evidence to suggest that crossing a leg vein will cause vein problems. Most of the time, if you're crossing your legs, you're sitting in one posture for a long time. So it's good to change the posture from sitting posture to, say, walking or standing, or just moving your legs to a recliner position. But crossing the leg would not cause varicose veins.
Okay. We have another question. Does everybody with varicose veins need surgery?
Okay, so does everybody with varicose veins need surgery? Like I said previously, most people with varicose vein do not need surgery. Most of the people, 80% in our case, even though we end up taking almost all patients who have some symptoms, they do really well with conservative therapy. And surgery is the last resort. If we need something in the 20% of cases, it's non-surgical treatment. So most people do not need surgery.
Okay.
That was a good question.
Okay. Rita would like to know what complications can occur from closing a vein.
Okay, closing a vein by any method. For example, if you are injecting a chemical inside a vein, or if we are putting an element of a heat element to close the vein. So we close the vein with the catheter inside under ultrasound guidance, and the heating function of the veins and causes inflammation in the leg. Many a times, along the line of the vein, along the inside of the thigh and along the inside of the lower leg, there might be a feeling that something is tight, like a tight rope, a stretching feeling inside the leg. This is not an uncommon feeling that is seen in around 20% of people after the procedures. Sometimes there could be redness along the line of the vein. The vein is not taken out surgically, but it is by heating method or by chemical method, by basically closed inside the leg by causing inflammation inside the vein. That inflammation can go on the skin and make it red and itchy. Many a times, a simple fix for that is either doing nothing or take a Benadryl as a treatment, antihistamine at night. Walking around, walking and avoiding immobilization also helps in such symptoms. Sometimes there could be a blood clot in the deep veins, and that can happen because after the vein procedure, because of the inflammation in the leg, and especially if somebody is less active. Oh, I have a surgery done today and I'm going to watch a movie today, or I'm going to relax all day, I'm not going to work. So because of immobility, and sometimes the heating from the vein can transfer to the deep system, and it can cause a blood clot in the deep system. It's extremely rare, but when it happens, there is a simple diagnosis by doing an ultrasound, and that's one of the reasons we check all veins after 1 week of procedure, and to make sure that they're doing well, they're nicely closed, and there's no blood clot. And sometimes a simple fix could be giving a little anticoagulant during the procedure.
Great. This is a very important question for a lot of us women. Does wearing high heels cause vein problems?
Okay, that's another very good and excellent question. So I have been approached multiple times with this question, and the biggest reason why high heels is not good for the purpose of circulation is that the calf muscle is the only pump we have in the leg to pump the blood fluid back to the heart. So when somebody is wearing high heel, the calf muscle is completely engaged. So the valves are closed. So the blood is not flowing well. So if somebody is in high heels, it basically impairs the muscular function at the calf. It impairs the ankle mobility, and that can lead in the long run to a to problem with the superficial or the deep veins. However, if somebody is careful that they are walking around and they also take the heels out in between, do the leg elevations, they can be used for a shorter function.
Great. Mary has a question. She would like to know if she can travel safely by plane with varicose veins.
Okay, so traveling means physical inactivity. So any travel, either by road or by plane, basically is a stress test for the veins. What happens is that the valves are not functioning. By gravity, the blood pools in the leg, and it can cause a blood clot formation in the leg. One of the reasons that traveling becomes, we always discuss about this aspect with most of our patients, is that the traveling can cause blood clot formation in the legs, and it is all preventable. So what do we do? Should we stop traveling? No, we do not need to stop traveling. If we are traveling by road, what we can do is, at a comfortable time, half an hour to 45 minutes, we can stop in the rest area, get up, walk around, hydrate ourselves, and drive again. Or if we're flying, it's important that we move our legs, little shaking of the legs, little elevation or the feet exercises, or just get up and walk around in between the seats is also helpful during the flights. What helps the most, however, is wearing a right type of a compression stockings. So even if you're wearing 10 to 15 millimeter mercury, which is a light compression stocks, that will help a lot in prevention of the blood clot formation.
Great. John would like to know, he says, I have to be on my feet for work. What can he do to prevent varicose veins due to standing?
Okay, so that is my problem too. That's a problem of bank tellers, as I said, most of the healthcare workers, bartenders, and everybody. Just because the profession demands that we have to stand too much on our feet doesn't mean that we change our professions. We have to work around it. How do we work around it? What we need to do is we need to set up some schedule. First of all, if you have to stand on your feet all day, it's important to keep moving. When we are moving, the calf muscle is contracting and relaxing, so that helps propel the blood, and we can avoid pooling of the blood in the lower legs. The second and another most important thing we can do is, during the break, one can lie down and elevate the legs. Especially if somebody is known to have varicose veins, they can clearly do this 3-4 times a day. And once you go home after the work, that's the best thing to do is, for 5 to 10 minutes, lie down and elevate your legs. That will basically improve all the damage that was done because of pulling, because of standing. Definitely wearing compression stock during work goes very well with most of us, and that will also help a lot.
Good. Let's see, looks like George has a question. What is the recovery time after a vein procedure? How quickly can I go back to work?
Most of the vein procedures are outpatient procedures, just like dentist chair procedures, even less invasive than that. And the procedure itself may take half an hour to 1 hour. And after the procedure, we recommend that you do not be in one position for a long time. So going back to work is what we advise most of the time. So one can easily go back to the work. I see many a time nurses, they come from the ER, get their procedure done in the morning, and then they finish their shift. So going back to the work is not a problem on the same day. Many people will have some oozing of the fluid because of the injection that was done around the veins of the lidocaine and saline. So we wrap the legs, and we recommend that with the wrap legs, it's good to walk around and not sit in one posture. So most of the people can go to the work after their surgeries. If they want to stay at home, we ask them to be active. One thing we do not want to is do not travel. So traveling is a risk factor for having a blood clot formation.
Well, what kind of symptoms would he expect after a vein surgery?
After the vein surgery, few weeks after the vein surgery, the first thing that gets better is the leg pain. If the pain is very classical, it's heaviness or achiness or tiredness that happens in one position for a long time, that gets better. Symptoms like swelling also improves, but there can be a partial improvement of these symptoms. That's one of the reasons we re-evaluate after some time to make sure that there are no other veins that are causing significant problems. One can, as I said, have a feeling of redness or swelling in the leg for a few days, but it gets better with time.
Okay. Diane says, my father and mother both have varicose veins. Are there steps I can take to avoid getting them too?
That is a good question. So let me start with this. So if your father and mother both have varicose veins, you have varicose veins. It's only 1 in 10 chance that you may not have it. So it's important to understand that it runs in the families, and it's important to take all precautions. For example, avoiding immobility, wearing compression stockings, doing leg elevations, being active, avoiding being overweight. All these things are very important because just varicose vein is not the problem. It is what we do to them is what is the problem. Even if you don't get varicose veins, it may get transferred to your family also. So it's important to take travel precautions as a family whenever you are traveling. And just because the parents had varicose veins, you are also at a risk of having varicose vein related problems. And even if you don't get it, it is important to do all the precautions.
Okay. Carol has a question. She says, what's the best way to keep my ankles from swelling while I'm working during the day?
Okay, like I said, avoid immobility, wear compression stockings, and being active would help. And leg elevation is also helpful at work. Most important thing that ends up happening at work is, especially people who have a computer-related job, so they are in one posture for a long time, and at the end of the day, leg swells multiple times than it was in the morning.
Let's see. I have another question coming across. Brenna would like to know, is it better to treat earlier rather than later in venous disease?
Okay, that is an excellent question. Vein diseases are chronically progressive condition. One-time treatment will help to some extent, but there's an ongoing chronic long-term therapy is needed, mostly in the form of conservative treatment. It's important to treat the vein diseases only when they become symptomatic. And till that time, conservative treatment holds good. When the symptoms are affecting quality of life, activities of daily living, mobility, or if there is an ulcer in the leg, or if the skin is very pigmented and it is changing colors and texture, that's the time you want to get it treated.
Great. Let's see. How can I make sure my compression stockings are a good fit?
Compression stockings, usually a proper sizing is needed. Most compression stockings, most vendors who are selling compression stockings, the pharmacies, they can do the sizing also before they prescribe you what type of stocking you need. The vein center at YRMC will do the free sizing if you want. You can call and come. We can do the free sizing. It's important that the compression stock fits tight. It has to feel tight. That means it's compressing from outside to make it better. If the stockings are very loose, or if they have that zipper function, the compression function is also lost. So many people end up buying comfortable socks. Comfortable socks are not definitely for somebody who has active vein-related problems. It may help some to some extent. They're better than nothing, and it definitely helps for people who have no known vein diseases, but they should be a real fit for the socks.
Great. What's the difference between prescription strength compression stockings and the kind that are sold over the counter?
All right, that's a very good question. Over-the-counter compression stockings may not be graduated compression stocking. So first thing, whenever you buy, say for example on Amazon or anything online or over-the-counter compression stockings, you want to make sure they have that function known as graduated compression. So that is the most important function. The second most important function is the strength and the material that it is using. The compression socks nowadays, they can come in different shapes, colors, sizes. You can have stripes, polka dots, and every type of compression stocking. You can match it to what you're wearing. You can have like leggings like compression, and which can match to your tops and all. So they're all available. What matters the most is the sizing of those socks. And I've seen that if you buy with over the counter or online, they are way more cheaper. And we usually at the vein center direct our patients to buy it online, but by guiding them which one to buy, which one, like giving a choice to make sure they have that protective function.
Great. Amy would like to know, Are fine spider veins a health concern?
Okay, so that's what we started with. Spider veins may be connected to the bigger, deeper system, and we may not know it. They might just be the tip of the iceberg. If you have spider veins and if you have any of the symptoms that in the legs, like aching, heaviness, or tiredness, itching, leg cramps, or any swelling in the legs, you definitely have something more than spider veins. So that need to be examined and checked.
Okay, what kinds of complications can varicose veins lead to during pregnancy? If you have varicose veins during pregnancy, does that mean you'll always have them?
Those are two questions. So first question is, what complications can happen in pregnancy? So pregnancy is a state where there is more blood volume in the body. It's also a hypercoagulable state, which means the blood is more easy to clot during the time. So if somebody has varicose veins, they can get blood clot in the legs or in the lungs during pregnancy. That's one of the complications can happen. Sometimes the blood clot can happen in the superficial veins, making the leg red and itchy and very painful. It's known as superficial vein thrombophlebitis that can also happen in the pregnancy. If somebody already had advanced vein disease during the pregnancy, apart from blood clot formation, they may get more advancement of the vein disease in the form of skin changes and even ulcers. So the best thing during pregnancy is to use compression stockings, walk more often, avoid immobility, and I repeat, do leg elevations.
Okay. And looks like my last question here. How do you go about developing individual treatment plans for vein center patients?
Okay, that is definitely a tough task. So it's a shared decision making between the physician and the provider. So what we do is we'll look at the ultrasound. We'll look at the type of the veins that we are dealing with. Are these tortuous veins? Are they straight veins? Do they have branches? Do they have multiple veins or a single vein? So based on that, we discuss multiple options, whether they need to go through the heat treatment, the RF ablation, or they want to go through the glue treatment, or they have to go through the foam treatment. So there are multiple types of treatments, and sometimes we combine them. It all depends on the type of veins that one have on ultrasound.
That's all I have for you.
Thank you. Any last questions? We're done? Okay. Another thing that we have at Vein Center developed a flyer. This will be available on healthconnect.org in a PDF format. This is about healthy legs and healthy circulations, some tips that we could offer. So please read them.